Namaste. I am Dr. Sai Sravan, Assistant Professor, Department of Community Medicine, Narayana Medical College, Nellore. So, as we are observing 16th of May every year as National Dengue Day, we are going to discuss few points regarding dengue. Dengue disease is caused by dengue virus, which is from arbovirus family, and dengue virus has 4 serotypes, that is dengue 1, dengue 2, dengue 3, dengue 4. Worldwide, all these 4 serotypes are prevalent. However, 1, 2 are more prevalent. More than 120 countries in the world are being affected by dengue, and among that, 400 million cases every year are being reported. And among that, more than 22,000 cases are being reporting a fatal outcome. That means 22,000 deaths are being reported in the year worldwide. Coming to dengue in India, more than 35 states, including Union territories, are being affected by dengue virus. And in India, mostly it is after monsoons, which is the time period for dengue infection. However, southern states along with Gujarat are being perennially affected, which means throughout the year there will be cases from these states. Coming to death rate in India, it is reported as 0.16%. However, severe cases will be reported from the cross infection of dengue 1 or dengue 2 viruses when people from age groups, infants, elderly, or from pregnant mothers. These are the age groups or special populations which are in the reporting of cases. Dengue virus is transmitted by mosquito. Aedes mosquito, Aedes aegypti and Aedes albopictus. These are the 2 species which will be transmitting dengue virus. Aedes mosquito breeds in the stagnant water in and around the houses, in the empty vessels or in the empty boxes where water can be stagnated or stored. Aedes mosquito transmits dengue fever from infective person to unhealthy human being. Infectivity of the human being starts from 1 day prior to starting of clinical symptoms to 5 days after starting the clinical symptoms. Once Aedes mosquito collects dengue virus from an infected human being, it propagates and replicates inside it for 8 to 10 days, which is called incubation period. In this period, it is not infective. So after this period, that means after collection of dengue virus from infected human being, 8 to 10 days it propagates, and then it will be infective to another human being. Once infective, Aedes mosquito will be infective for its lifetime. Dengue disease, based on its severity and clinical symptoms, it is classified into dengue fever, dengue hemorrhagic fever, and dengue hemorrhagic shock syndrome. Among this, dengue fever is the milder form and which lasts for 2 to 7 days. It is generally a self-limiting disease. It generally lasts for 2 to 7 days. Symptoms ranging from fever, myalgia, nausea, vomiting, and rashes, and eye pain, body aches. Symptoms ranging from fever, nausea, vomiting, body pains, eye pain, headache, and then rashes. Dengue hemorrhagic fever and hemorrhagic shock syndrome are more severe forms of dengue disease. Symptoms ranging from all the symptoms which are said in dengue fever, and along with it bleeding tendencies, that means bleeding from nose, bleeding from rectum, bleeding internally, or blood in vomiting, blood in sputum, internal bleeding resulting in shock, which again leading to death. Management of dengue fever, mostly symptomatic or supportive therapy. Whenever required, platelet transfusion or blood transfusion is must. Prevention of dengue fever. When we talk about prevention of dengue fever, we have to avoid mosquito bites by wearing full sleeves or long pants, and then by using mosquito repellents when we are sleeping, or using mosquito nets. Mosquito breeding sites needs to be thoroughly removed, and then all the breeding sites needs to be sanitized, and then we have to protect ourselves from dengue. Let's break dengue. Thank you all for patient listening.